Hi, this is Megan from Step Up for Mental Health. I will be taking over this podcast for the next few weeks. To address the various social justice issues that are embedded within American society, I want to take some time to recognize how the field of mental health contributes to the injustices against marginalized communities. Specifically, how it can serve and excuse the prison industrial complex in ways we do not expect. In the next few weeks, we will take time to address social justice issues that pertain to the field of mental health, as well as ways we can advocate for change that will benefit the communities who are disproportionately targeted by the criminal justice system and largely neglected by the field of mental health. Much like the deinstitutionalization myth we discussed previously, the idea that we need to implement more mental health programs or care within prison facilities comes from an uneducated perspective of the matter. Less than a year ago, if someone asked me whether a prison or jails or any detention facilities should increase their mental health care, I would have said yes, they do. Today on Mental Talk, Step Up for Change, we will be discussing the unnoticed ways mental health care in prisons are an extension of state violence against incarcerated people in marginalized communities. This podcast is central to understanding how the field of mental health and professionals are complicit and/or an extension of state violence used to control the lives of marginalized communities. So far, most of the topics we've explored tied together mental health, the prison system, and social justice matters. Helping us understand the ways they are related to one another, we have started to see how psychology, academia, and mental health professionals can twist narratives to place blame on individuals without acknowledging the way the state weaponizes deteriorating environments like poverty, homelessness, or prisons, and then forces marginalized individuals into these environments as a form of control. This podcast is going to explore the ways mental health programs and professionals within prisons can abuse their power and further control the bodies and lives of people who are incarcerated. I was unaware of how prison staff could use something so important to people who are incarcerated. However, this was before I fully understood the way prisons manipulate mental health care to control the people within their facilities. I was first taught about the underlying violence mental health treatment does to people this year during a college course. Much of what I know now about state violence and the intentional targeting of Black and brown bodies has come from the classwork with one amazing professor I was lucky enough to have. Most of what I learned was not new to me, but rather dove deeper into the details, was provide mental health care and overall health care that once again looked at how the individual was at fault. I saw titles like How to Treat an Inmate with Prior Substance Abuse, or How Empirical Literature Aids to the Carceral State by Shifting the Attention away from governmental abuse or human rights violations, and instead focuses on the problems wrong with the people, subtly suggesting that is where we need to begin to fix the problem at hand, rather than recognizing the larger problems with our policies, practices, and punishments that influences our lives, behaviors, and beliefs. The prevalence of substance abuse among criminals. This is the first way we see psychology, psychiatry, academia, and mental health playing into the twisted narrative that helps cover up the violence people experience from the prison system. All of the podcasts we have talked about. One study by Flores and Bajarona Lopez discovered how mental health staff and correctional officers were using psychotropic medication and partaking in invasive therapy against young women within a juvenile detention center. They term this process as pharmaceutical violence. The article begins by recognizing what I stated previously, that there is an underwhelming amount of empirical work that focuses on how pharmaceuticals are used within detention centers or prisons, and instead focuses on the misuse of pharmaceuticals by adults as a reason for their current incarceration or even in reference to future offenses. Additionally, we are not told about the ways the state uses legal procedures to force incarcerated people, in this case, in this study, incarcerated women, to use these prescribed drugs. These drugs are often used to keep incarcerated people silent and docile, to make them easily controllable and sedated. Through these drugs, prison staff can keep women and young girls complicit, allowing prison staff to continue on with their abuse and unjust policies of mass incarceration. The medical sedation of incarcerated people is hidden by the guise that, and in some cases, these women may even be sedated involuntarily. Though all people incarcerated are vulnerable to the medicalized abuse from mental health professionals within this facility, it is important to note how women of color are especially targeted through this means of abuse. The work done by Flores and Lopez was aimed at researching the ways Latino women in juvenile detention are perceived to be a threat to the public as well as the prison environment and are experiencing pharmaceutical violence. The first thing I want to acknowledge from their work, and many other articles as well, is the fact that people incarcerated are not free to make their own decisions. Despite what you think or what officials say, there are very formal and informal methods of getting someone to do what you want within prison, especially when the person making the demands is in a position of power. First, there are regulations and codes that allow prison staff to medicate someone against their will. For example, in the study in California where it took place, the California Code of Regulations states that the practices within the prisons are simply mental health staff providing services to imprisoned people. This narrative also leads us to believe that the prison conditions might not be so inhumane, as they are caring for the mental well-being of those incarcerated. This disguise only allows those not incarcerated to live without a second thought about the conditions of prisons, as well as allowing the prison system and state to expand their methods of control and abuse among marginalized people. It should be noted that empirically we see more women than men being sedated through psychotropics, especially women of color, very susceptible to forced medication due to prison codes we discussed earlier. However, prior to their incarceration, the experiences and social positions these young women of color have, both due to intersectionality of their race and gender, may have resulted in a sense of powerlessness against the state. These women may feel as if they cannot refuse or even question their healthcare treatment, that they must accept their incarcerated diagnosis, to take the prescribed medication, and to engage in prison therapy. The prison industrial complex survives off of this power imbalance between state agents or prison staff and those who are incarcerated, with the clear targetization of certain classes, races, and genders. In fact, Hatch and Bradley note that racism is central to pharmaceutical violence against incarcerated individuals. I hope then it is clear to see how the use of medication for incarcerated people is typically a form of legal violence used by the state as a means of control and abuse. Legal violence is, quote, the various mutually reinforcing forms of violence that the law makes possible and amplifies, end quote. Now, some people may look at what we have discussed thus far and ask, isn't it a good thing that people are getting treated for their diagnosis that may help with their symptoms they're experiencing? Yes, it is good to provide everyone with mental health treatment, of course. However, the way that medication is being administered within prisons is not for the sake of treating people's disorders or helping them out, but rather as a method of control. This is how the prison industrial complex is using mental health and mental health care as a means of control. To help explain this, I will be using the data from Flores and Lopez study involving young Latina minors, as well as a study from Kilty involving incarcerated women in Canada to help explain and showcase pharmaceutical violence. Flores and Lopez found that the violence was made up of three different stages. First, diagnosis and treatment lead to psychological harms through mistreatment. Second, patients were subject to medication and/or talk therapy within the structure that forced these young women to participate in the treatment plan. And lastly, quote, many of them attempted to negotiate the long-term effects of the mistreatment and medication in the community without the support of mental health professionals, end quote. The data from this study gives us personal accounts of what these young women experienced with mental health staff within the detention center. During the diagnosis process, many of the women felt that the doctor was disrespectful to them, often making racist or sexist comments during the appointment. Some of the women shared experiences where the psychiatrist scolded them during the appointment, or even created an uncomfortable environment while they talked. These participants also acknowledged the feeling of power imbalance. In this case, the psychiatrist was an older man who held a status of power within the detention center. These girls came from lower class backgrounds and have an intersectional identity with race and gender. Oftentimes, these young women were denied legal representation and were not informed that they could refuse service. So for some, they felt as if they were being forced to express their emotions and feelings to a complete stranger who held extreme power over these women. Additionally, the psychiatrist was reported to have diagnosed participants without their knowledge. In fact, many of the girls found these appointments to be harming their psychological health rather than helping, and other staff members observed participants' behaviors to be worse after seeing the doctor. These few experiences alone are evidence of the legal violence these women were subject to. Visits to the doctor can be summed up as a degrading experience where he often demonstrated his power over the girls and engaged in patriarchal, sexist, and racist behavior towards these women of color. These experiences alone had repercussions on their mental well-being. Many of the participants also identified the pattern that many girls in the center who were similar to them, meaning Latina girls from a particular class or socioeconomic status, were all diagnosed with multiple disorders and often had the same diagnosis. This suggests that the psychiatrist was quick to diagnose these young women with multiple disorders that they sometimes felt were untrue. One participant reflected on this by explaining how the doctor diagnosed her with PTSD and depression, but did not feel that she had the symptoms of depression. Additionally, the participants shared that most of the time the medication did not work. They would experience horrible side effects and something or nothing at all. Some of the participants explained how they would go to the doctor about insomnia and come out with a medication used to treat depression with only a short assessment. On top of the careless assessment and treatment plans these young girls are given, many of the participants also reported that these medications made them feel sedated. One participant stated, quote, when I'm on pills, it's just like even worse than being stoned. I'm like a zombie. That's how I felt when they gave it to me. Like a zombie. And then I stopped and I feel normal, end quote. She felt like she had lost herself and her freedom, not only due to her incarceration, but also by the medical prescription and mental health care she received. The drugs had effect on these young women, making them feel numb, drugged, sedated, sleepy when they shouldn't be, an overall lack of who they are and the loss of their feelings. It altered their mindset. This is what pharmaceutical violence is. They grew physically dependent on the medication. Many of the participants explained how once released they did not have access to the medications their bodies depended on. So they again experienced adverse side effects of withdrawal. Withdrawal is a challenging and painful process. Some participants explained how it impacted their emotions, making them feel angry and burst out, while some fell into a deep depression. Either way, the withdrawals of medication was occasionally a factor in the reincarceration of some girls. The participants were well aware of this reality as well. During the interviews, some participants explained how during their time in the detention center, they stopped taking the medication in order to stop themselves from becoming dependent. One participant explained that she did this, knowing that outside of the facility, withdrawals from the medication could result in erratic behavior. These girls found a way to ease themselves off of medication from hiding pills, throwing them away, controlling their own dosage, or stopping altogether. However, the facility and staff could use disciplinary actions against minors who refused treatment. The side effects of withdrawal can make the tight regulations of probation even more difficult for young women being released. This is another way the state, through the use of pharmaceuticals, are controlling their lives. By forcing medication into their systems, formally and informally, these girls are given a disadvantaged start with probation. If they do not personally ease themselves off of these hard drugs, they will experience a harsh withdrawal. Therefore, the detention centers are creating a situation that can likely result in re-entry for these girls and keep them under the control of medication. They have created a vicious cycle that is meant to make it more difficult for these girls to succeed after they are released, harming their mental well-being through improper prescriptions. Finally, within the study, they also discussed how medication proved to be an obstacle for these girls once released from their detention center. The medications numbed their emotions. In the study by Kilty, women who were formerly incarcerated in Canada were interviewed. Kilty reported the same power imbalance problems between psych staff and patients, as well as the lack of choice when it comes to the medications they are on. The medication should be reassessed, which never happened for these women. One participant explained her experience, stating that she was diagnosed with schizophrenia and prescribed this drug. However, she was not schizophrenic, but rather coming off of crystal meth and morphine. Her experience was not uncommon. Medical staff would briefly assess women. Sounds like without even a regard to potential withdrawals someone may be going through. This drug resulted in similar experiences. This drug leaves the effects of sedation, vivid and intense nightmares, resulting in anxiety. They would prevent the participants from taking a medication they were using for treating their diagnosis and instead place them on a new medication with the sole purpose of sedating them. One participant explained how she was given a certain prescription from a treatment center for her mental health. One participant explained, quote, "They heavily medicate people in prison, so you don't cause a disruptance," end quote, essentially to better manage them. Additionally, the doctors within prisons would deny participants the medications they were prescribed by another professional before being incarcerated. In this study, many participants share a common drug known as Seroquel, which is an antipsychotic used for schizophrenia and acute manic depressive disorders. To the last study, these women explained a feeling of sedation, sleepy, out of it, constantly tired. Finally, the irony, the doctor took away her access to the medication. The same woman explains how everything was taken from her, how there were no alternative treatments like therapy, peer support, or programs. Another participant showed how she was taken off of her prescription that she was on for 2 years prior, solely because the doctor did, quote, "whatever they wanted," and the opposite of what you were on, in order to show how they had control over you, end quote. To their persistence on medicating these women who were imprisoned is the denial of all other medical treatments. One participant within the study explained to Kilty how she was denied her blood pressure medication. The only explanation she was offered was that her blood pressure was normal. The participant then explained that her blood pressure was normal only because she had been using the medication to regulate it for so long. So how can you explain that these mental health professionals are truly caring for those incarcerated women when they are denying them access to previous prescriptions for their physical health as well as their prior medication for their mental health diagnosis? The professionals within the prisons are replacing these medications with antipsychotic medications that work as a sedative to control and manage these women easily. The doctors give little attention and time to assess the women who come into the facility and rarely ever revisit the patient and note any mental or behavioral change from that medication. These are intentional acts by mental health prison staff to control women through pharmaceutical violence. I want to wrap up this podcast by saying I'm not advocating for the removal of mental health care in prisons. But when mental health care is provided through the prison, the state and staff can use medication as a method to control and harm incarcerated people. One suggestion that I've heard is using a third party to deal with health care of people incarcerated. By removing the doctors from the prison, the idea is hopefully that professionals' interests would then be to care for the individual rather than achieving the prison's goal for control. There's a lot of research that still needs to be done regarding the medication as a form of violence against incarcerated people. Many abolitionists are looking at ways to improve the health care of people currently incarcerated. The best thing we can do to change a system that is designed to harm people is by listening to the people who are and have been incarcerated. They know what they need better than anyone else. That is where change has to begin. I hope this podcast provided you with something new to think about, especially if you're in the field of mental health. I encourage you to look at how your field may be problematic or complicit to the harms of other people. Next week, we'll focus more on how reform is not the answer to solving these problems. I look forward to that discussion, and we'll talk to you soon.